Today, it was mainly about the master site plan and where we're going with that. As you know, the master site plan is a work in progress. It started over about a year ago. We started the master site plan. It's now down into a draft master site plan. And the next steps for us are to take it to our board, again as a draft, and then after the board will take it to the regional district as a draft, and then we put it into the mix in our capital requests for the ministry. So there's a whole sequence of events that we need to go through before the master site plan is approved. Really, the master site plan is looking at the physical capabilities and the space, the box that we're going to be put the services in. So that's the next step as we move through the process, is to determine, what are the services that we should be providing here. As I've said many times, that this is a tertiary hospital. It will continue to be a tertiary hospital. It does do a lot of trauma for the area. So whether or not we designate this as a center of excellence, or say that it continues to do what they're doing now, that'll be determined in the future. It's looking at the physical space that we have on this piece of property to say, how do we move things around so that we can address the issues of space, address the issues of parking, and that's the biggest component. And obviously we're on a site that's on a hillside, so how do we minimize the effects of the hill? Do we go up, do we go out? Those are the things that we look at the master site. But I think, the thing about parking is we may have a problem now, but we're building for 10 or 15 years from now, and we have to project what are the parking needs going to be in a society that's changing. We have to be innovative for our staff. As it is now, we try to be innovative to say to staff, do you need to bring a car to this site? Are there other things that we can do? Certainly people who travel in from other locations, there's other things that we can do as well to try and minimize the need for physical space for parking. We met with doctors on Monday night. Okay. The biggest issue that that they had and that we're addressing is the issue of wait times and OR times. As you know, we've worked with the clinicians to contract out some of the services to the private surgery center. Those services are services that were being done in an operating room that could be done in a non-operating room facility, so that frees up OR time for us to work on their wait lists. So that was a concern for them. And I think there's a misconception about the amount of capital that's gone in here, and there's this competition with Kelowna. Obviously, Kelowna has got the heart center. It was the right location for that, and there was the expenditure to do that. If we take the expenditure on the capital for the advancements in Kelowna, take that out, and we look at compare both Kelowna and Kamloops over the last 10 years, there's been over $10 million more that's gone on to Royal Inland than it's gone into Kelowna. $75 million here, it's $65 million.
You can't separate the two, can you?
Pardon me?
Is it possible to separate the two?
I just did.
Yeah, no, I'm just saying, I mean, most people will look at it, you can't separate a billion and it's 70 million.
Well, no, but I mean, the billion is for all of interior health. I mean, we've had over 200 people from this site that have gone to Kelowna to have their PCIs that previously would have had to go to the coast and may not have made it. So this issue of comparing the two sites, we're looking at what's best for all of interior health. When we take that out, again, there was more money spent here than in Kelowna. The public has to understand, and really is we're here to provide service to the residents of all of interior health. The fact that you have an open heart center coming in Kelowna is going to save lives for people in Kamloops and in Clearwater and all these different locations. We've got two large centers where the population is growing, where in a lot of our rural sites the population is diminishing. I don't see anywhere in the foreseeable future that we would not have two tertiary sites. It's absolutely reasonable that you expect a full-service tertiary care hospital and the facilities to do that. Obviously, as we look forward, we have to look at what the volumes of surgery that we're going to be doing, what are the types of patients that are going to be admitted to tertiary care centers, how do we integrate that with the primary care models that are going on there. This area serves all of the, Thompson Caribou as the hub. So for the suggestion that this would be diminished to a community care hospital, it's just not in the foreseeable future at all.
What's an update on the heliport? I know when the Minister of Health was here, he found it quite puzzling that it wasn't in operation. Can you tell us that?
Yeah, we're still working on that. We're doing some studies. So once that's completed.
Any timelines?
No, I don't have anything right now.